Well, welcome everyone to our Better Together Facebook, LinkedIn, and YouTube live series. I'm Penny Cook. I'm the president and CEO of Pioneer Network, and I'm here with a few of my friends. First of all, representing the Eden Alternative, Chris Angevine. Chris, great to see you.
Thank you so much, and hello to everybody out there. Pleasure to be here.
And we'll introduce our guests in just a moment, but I want to introduce our topic for today. There are no right answers: vaccines, visitation, and using ethics to guide the road ahead. I think in the past couple years with COVID, we have just encountered so many ethical issues, and especially regarding older adults and in the realm of senior living and care as well. And so we wanted to talk about that a little bit today. So we have two guests with us that I'm so excited to have. We have Beth Irtz, and they're both from Colorado, where I am too, which is so exciting for me. We have Beth Irtz, and I've had the pleasure of working with Beth, oh my goodness, since I started as an ombudsman back in 2003. I think that Beth and I first met. So Beth is here with us today, and Jerebker, who was the former CEO of Pinion Management, and he was also a Pioneer Network board member as well. So Beth and Jeff, thank you both for being here to help us talk about this lively topic.
Thank you.
And Jeff, I think that, before we get into sort of the meat of this topic, we really need to give some context of even why we're talking about it. So do you want to kick that off?
Sure. Thank you. Well, as Penny alluded to, I had a management company called Pinion from 1979 to 2011. In around 2002, Pinion formed an ethics committee. It was inspired by the state ombudsman who had recently resigned, Virginia Frazier, and she came to work for Pinion Management as her last job, you might say. And one of her ideas was, why don't you guys form an ethics committee? So we researched it, and we came up with an ethics committee, and we really brought topics that are not normally discussed in leadership groups or anything like that. These are very controversial and significant issues, and as the title suggests, has no right answers per se. So perhaps maybe from that, I'll go into a background of ethics committees and how we got there. The purpose and the structure of ethics committee is to assist in making decisions about healthcare for residents, patients, families, staff, etc., that face difficult and potentially life-changing situations. Ethically challenging what is most appropriate or preferred course of action. It offers assistance and facilitates sound decision making. This is critical. It facilitates sound decision making, but it actually doesn't authorize a decision making. Ethics committees provide support and guidance, education, communication, rather than, as I said, decision making. The organization is not required to accept the recommendations that come out of an ethics committee, but they do have some obligation when they don't, to explain why they disagree with an ethics committee. Obviously, they respect the rights and privacy of all participants and privacy of the deliberations. Membership should be diverse perspective, diverse expertise, experience, community representatives, spiritual, depending on the nature of the issue. In Pinion's case, because we manage nursing homes, we always had a health department representative. We had an ombudsman and other advocate representatives, including elder law attorneys, community elders, spiritual leaders, as I said, other healthcare providers, even competitive nursing homes. Competition doesn't matter when you do an ethics committee. Mental health agencies, etc. The principles of the ethics committee, which was outlined when we developed this, and that will be linked in this presentation. It's important to uphold those principles, and when stating a position on an issue, that you cite the principles that refer to what you are stating. And obviously, it takes a good facilitator that knows how to facilitate a conversation, knows how to manage the proper protocols, and is very familiar with the ethics principles. In healthcare has a long tradition of ethics committees, and hospitals really have always, for a long time, had an ethics committee, but nursing homes not so much. And when we formed the ethics committee in 2002, there wasn't any Denver area ethics committee that I was aware of at the time. And we had our medical director, Dr. Fred Feinsott, one of my heroes in life, heading it up. And we met monthly. We had a preset agenda. We invited the public, and we invited guest expertise as part of the discussion. Sometimes it drew a big audience. And then one time, a very controversial issue, which was the right to die. This one sticks in my mind because Dr. Fred Feinsott, the facilitator, he got this prominent author of The Right to Die and a medical doctor out of, I think it was either Denmark or I think it was Denmark, to call in to our ethics committee and present his viewpoint about nursing home residents and how to deal with right to die issues. And that generated a huge discussion. We also had, that was an example of a controversial topic. Ethics committee, when COVID hit, as Penny alluded to, all sorts of ethical situations arose. And we had a Pioneer Network has a council of elders, and we presented the possibility of developing either a white paper or something as to how to deal with vaccine hesitancy among staff through an ethic committee lens, and how to deal with visitation for nursing home residents and elders, also through the lens of an ethics committee. We piggybacked on the successor to the Opinion Ethics Committee, now the Vivage Ethics Committee, and we participated in their monthly meeting to help us with this paper. Beth Irtz did an amazing job, and we had help from Wendy Lesbader and Joanne Rader and Penny Cook. And it was a collaborative effort, and the work would also be linked in this presentation. So that's a little introduction, I think, of how we got on this path. We did some research as how other nursing homes are dealing with vaccine hesitancy, and et cetera, and that gave us some ideas also, as well as the Vivage Ethics Committee. So, Beth, would you like to
Sure.
take it on?
Yeah, for those of you who don't know Jeff and I, many of you who probably watch this will know us, but Jeff and I worked together at Pinion Management. We served on both the Colorado Healthcare Association and the Colorado Culture Change Coalition boards together. So we've done some things together just as friends. We've kept in touch in retirement. I'd say we're both retired, but we seem to work pretty hard relevant to the things that are important in our lives, like how the elders in long-term care are cared for. It's really important to all of us today that are on the broadcast. And I'm really happy to be here with you, Penny and Chris. The Eden Alternative and the Pioneer Network have always been very important to me and have given me a lot of new ideas, support, direction for a lot of years. So I really appreciate that. I am an Eden educator, and the Eden principles and the principles of Pioneer are just so important in order to get an understanding understanding of what I want to talk about for a few minutes. Before I go there, I just want to tag on to Jeff about opinion ethics and now the Vivage Ethics Committee. One of the things that we talked about in our paper that you'll see was a call to action. And one of the, if you go to McKnight's, and there'll be a link here for the paper, you'll be able to see that we suggested every community needs an ethics committee. In Metro Denver, having the opinion and then now the Vivage Ethics Committee has helped so many providers. Jeff mentioned this, that it's not about who's your competitor, but trying to do the right thing for the elder. And ethics isn't about this is the final decision. That's why we're talking about no right answers, even when you use ethics, but ethics can really help you feel confident in why you might have made decisions that you did. So one of the really cool things that came up while we were developing the white paper was the elder as the North Star, the elder as the guiding star. And this was really, I'll speak for Wendy Lesbader, although I wish she were here. You could hear her speak. If you're ever somewhere with a Wendy, go to a program that she's doing because she's really wonderful. And you could look up her books later. She's authored many books, but she started talking with Jeff and Joanne, Penny, and I about the North Star and how the mariner used the North Star on their voyage to know where they were and what the right direction was. So she continued to offer that up to us. And it is documented in our paper that we used this idea, philosophy, understanding about the elder being the North Star, the guiding light for us. And so when we were stuck, or maybe we heard a story where someone was stuck in visitation or vaccine hesitancy, you could always talk about how do these principles, these ethical principles, then relate back to the elder. How are they the guiding light, the star? So we, in this paper, developed many stories. Jeff was really interested in this nursing home in Washington, D.C. He could talk about it in a few minutes. We're going to have a little conversation between us. And we all collected stories, and then we used the ethical principles to identify how they would help us come to some direction, some guiding light about that elder and the situation or that community or home that they were in. So that was a really telling piece for us. And we hope that that might be one takeaway today. Maybe you've never seen these ethical principles before. They're well documented and researched. Wendy, again, reminded all of us that they're nuanced. And there may be some in here that we never use and others that we may add in to a specific situation. And at this Vivage Ethics Committee, we have an ethicist. Her name's Patsy, and she's a nurse ethicist. She's been certified. And it's really helpful to hear after she's listened to discussion, to hear this. I think she's also appreciated hearing that the elder's well-being is the guiding star, and that she goes back there in conversations. And I don't want to lose the fact that Jeff said they were so important to us in developing this paper and making some recommendations. So work on, if you can, the development of an ethics committee. It may start small. The Vivage Ethics Committee, grown out of opinion management, today I would say is formidable. It's large. Into a physician who's I believe she's a psychiatrist or a physician in behavioral health. She attends every month. So you get this perspective of what's going on with the elder, what's going on with their medications, so many things, these principles, how do we do no harm? And so I would encourage you to get going in your communities to think about this. The pandemic has brought this to light for us, and we're very happy that we could go back and look at these, and grateful to Fred Feinsod, who is one of the developers of these of these principles. So I'll talk a minute. Jeff and I are going to have a conversation, and I know that Chris will look at questions for you. And Chris, could you put up that 10 ethical principles in geriatrics for just a minute? So there's a link to this document. We've reformatted it in case Dr. Feinsod and others take a look at it, just so that you could really read it and look at it while we were on this broadcast today. We do use beneficence, that first principle about do what's right, do good, and non-malfeasance, avoiding harm, pretty often. We also used autonomy of a staff member, autonomy of an elder or their family. Also the confidentiality piece, which is not new to you. So you can look through these principles, and I think they'll be pretty, you might not have seen them termed this way as ethical principles, but you'll see how meaningful they are in your work. Okay, so let's move on then. I think I got everything covered that we talked about. So Jeff, I'm going to pose this question to you for a minute. So how can I or you be compassionate about staff who are refusing vaccination? So refusing vaccination and compassion.
Yes. So first of all, I think you got to be in a meditative state of mind to help you with that. But I would say that I looked at that Washington, D.C. nursing home. We got some publicity. There's an administrator named Tina Sandri. She was the administrator of Forest Hills, not to be confused with Queens, New York, nursing home that's in Washington, D.C. She had an issue with vaccine hesitancy in her nursing home. And she employed principles of servant leadership that really blew me away. And she describes it in pretty detail with an article. And what she did is all the staff members that were hesitant, she would meet with them one-on-one first and recognize their concern, legitimize their concern, which will vary depending on the particular staff member. There was a number of concerns depending on the perspective. So if it was, she had a high percentage of African-American staff, and she was aware of the hesitancy because of past malpractice. So she was very empathetic with them, and what she would do is bring in resources from the Black community that was explaining the efficacy of this vaccine, and she would have them meet with them. In other staff members, for example, regardless of ethnicity, if they were empirically oriented or they wanted to see facts and figures, et cetera, she would meet with them and present the latest research and go over it with them, et cetera. So she was very patient, and depending on the hesitancy, she recognized the hesitancy and the legitimacy of the hesitancy, and then she would present them all the current information and how it would be better, and trying to convince them through that method and that patient methods to consider taking the vaccine. It was a strategy that worked very well in her case, and she got, within, I think, a month, over 80% of her staff was vaccinated, which is not 100%, but she went from like 35 or 40% to 80% without having to without having threatening that saying you're going to lose your job. She never employed that tactic. She also never employed what she called the tactic of giving bonuses for taking the vaccine. She had an interesting take on that. She said she thought it was patronizing. Like, if you have a legitimate reason why you are hesitant to take the vaccine, why should money or bonuses buy you off? That was her attitude, because if you have a legitimate concern, you have a legitimate concern, and money is not relevant. So without using that tactic, which is a popular tactic, but she was able to convince to get to that level. So I think your first effort is to meet them where they are, true empathy. And I myself, in my personal life, I have a history of vaccine hesitancy, not with this pandemic particularly, but in my life. I've only taken the flu vaccine 3 times in my life. And I've had 2 of my children not get vaccinated with anything other than homeopathic vaccinations, which is not accepted by the medical establishment. So I kind of understand, and I had a reason for that, and my reason was healthy lifestyles, natural immunity to be built up by healthy lifestyles, et cetera, rather than, choosing the vaccination route. But I've changed in the sense that we're in a worldwide pandemic. So, but because of my background, I could have some empathy with staff that's saying, well, it's a new vaccine, we're being used as guinea pigs, we don't know the long-term results, and et cetera, et cetera. A lot of that is true. We don't know the long-term results. We only know short-term results, which are favorable. But we're in an existential situation. So I think ethics committee and meeting people where they are is a very first step, in my opinion, to make progress on this. Although now we have vaccine mandates, so some of this might be moot points, but it doesn't deny the possibility of a frank discussion to try to save staff, even when vaccine mandates are in effect.
I think back, Jeff, when we were first going to the ethics committee and developing this article or this white paper. This was back 6 months ago, and back then we didn't have the same information that we have today. I heard a lot from young staff in nursing homes, young female staff, about issues like fertility, which you have to take in a compassionate way, about them wanting to be careful if they're moving forward with their life and maybe starting a family. And so that kind of speaks to the autonomy in ethics. And then you're dealing in all of this. It makes me think about Mary Telesnayak and Vivian's book on compassionate leadership, that the nursing home administrator that you're speaking of in Washington, we talked a lot about that article. It was, if I remember right, Jeff, it was in the New York Times. Is that right?
Yes, it was in the New York Times.
And we talked about that a lot, about, what's the right thing to do here, and the autonomy of the staff making their own decision and what they feel comfortable with, and yet taking care of an elder. About the time this article came out and we were talking about it, most elders that were going to take the vaccine right away had been vaccinated, at least here in Colorado. We started vaccinations here for elders living in long-term care and assisted living back in late December, as I recall. And so you have to counter that with what's the right thing to do here. You don't want the elder, still building up immunity and waiting on that second vaccine. And, then we were bombarded with what's going to happen next. Are we going to take more vaccine? And staff that we really needed. The nursing home staff we really needed. And today, 6 months later, we're hearing about staff that have just left healthcare. And don't want to do this anymore because of the pandemic. And I've had lots of experience in the last 6 months trying to see how compassionate I can be about the staff that I might be coming in contact with. And I realize that they need expertise and understanding, but that's not necessarily going to change their mind about vaccination for themselves personally. I do see them being willing to do whatever's necessary, like wearing a mask, a shield, really making sure that they understand the use of personal protective equipment. And so I see that compassion reciprocal. Still really caring for the elder. I still struggle with, if we use this concept we develop about the elder's well-being being the guiding star, then vaccination for the staff is the right thing to do. And I think Jeff's comments are important about the fact that nursing homes started very low in vaccination rates with staff. Elders took the vaccine. We got up to, in Colorado, 80 and 90% pretty quickly. But staff were hesitant still. And we started with very low numbers. But Jeff's comments about that nursing home administrator meeting personally, I know of other stories just like that. And the trade associations developing anonymous call-in times when a medical director or physician could talk with the staff privately. So they don't have to go to their medical director to say, I'm not sure about the vaccine. They could talk to somebody else and get answers to questions that they have. So here, that approach was, they talked about that at the ethics committee. That approach was really helpful, and that moved our vaccine rate again. Even there was still hesitancy, but it continued. All these steps that were taken moved it up. And so I do think, even though you may want to be at 100% with no waivers today, with no one claiming religious exemption and no one claiming other waivers for medical reasons, that you want to just get as close as you can so that you're still working on that elder being the guiding star for vaccination.
You know, Beth, I thought your story was extremely instructive, which was the learning circles, bringing the elders into the learning circle about vaccinations, and for the staff to hear it from the residents about how important it is to them that the staff is vaccinated.
Yes, that's a good point. And that's a nursing home that I'm familiar with and have a friend who is the director of nursing. And it's been her approach for some time on their neighborhoods to use learning circles to bring up really either conflict or issues or concerns that might be going on in the neighborhood. Pretty amazing that most of the staff can facilitate a learning circle themselves. Chris, they're an Eden registered home, and they just do a fabulous job. So she said to me that it was hard to not go back to those traditional ways in the midst of the pandemic, but she knew that the right thing for their community was to use their approaches with the elder that they, in learning circles that they had always used on the neighborhoods, so that conversations could go on and staff could hear how important that was. I'm really glad you brought that up. So, you know, there's places out there that many, I'm sure, that are using some of these approaches and still trying to get people vaccinated today. So
we grappled with one of the ethic principles that was the hardest to grapple with, in my recollection, on this issue was autonomy. Because on autonomy, on the one hand, you say, well, the staff has their right as in autonomy to not take the vaccine or to take the vaccine. That's their right. That's an ethic principle. But there's also so that has to be weighed in and it was weighed in our deliberations. And the thing that tipped us in some ways was when the suggestion that we have a North Star. And why are we in nursing homes? We're in nursing homes to serve the elders. So what are okay, you have the freedom as a staff person to not take the vaccine, but what are the consequences of that decision when you work in a situation that we have a virus that attacks the elders in particularly, especially weakened elders that are in your nursing home? What is your responsibility with that autonomy, with that freedom? And that's what led us into the direction this paper took in a lot of ways.
And I do think it's important to remind everyone listening that different organizations, different nursing homes, assisted living have developed different approaches to this. And we're not trying to say that there's a right or a wrong approach, but that there's ways to have compassion in all of this, regardless of the decisions that people are making. And Jeff and I are exact opposites about vaccination. And I say that because, my mother had, back then, we all got that smallpox. Did you get smallpox, Jeff? Yeah.
Oh, yeah.
We all got that smallpox little scar on our arm, people who are from our generation, we eradicated smallpox back then. But there was no measles, mumps, rubella, chickenpox when we were growing up. We got diseases maybe, and maybe from siblings, kids who were school age. But today they have vaccination for that. And there has been a movement in the country, you're right, against vaccination. Lots of parents don't want their children vaccinated. It'll be interesting now that children's vaccines are available. Just this morning, my friends were posting on Facebook, their children, a few of them, a few families, their children in line getting vaccinated. So now we're here in a whole nother place. And maybe that'll help us, even though we have staff that has decided not to be vaccinated. And places that I'm aware of are not asking staff to leave because they're not vaccinated. They're trying to find a way through it, an appropriate way through it. So you're right, though, autonomy ended up being a tough thing to talk about sometimes. Whose autonomy are we talking about? Whose is more important, right?
The residents have the right to be in a safe environment versus your right to not take the vaccine.
Right.
That's an interesting dialectic. And since the North Star is guided towards the welfare of the resident, our direction became more clear.
Yes. Penny, were you going to say something?
Well, I wanted to ask a question. I also want to encourage other people to ask a question. But as you're talking, I just have like another question about this piece of it does go to autonomy, but it also goes to what I would consider the resident choice. You know, my stepfather is living in a nursing home now, and my mom wanted to know if all of the caregivers that are supporting him, from CNAs to the dining staff, were vaccinated. That was important to her to know that the people caring for her husband were vaccinated. And as I told this story to other people, people said, oh, yeah, my mom was asking, if her caregivers were vaccinated, but they wouldn't tell us that. And so, that's one of those thorny issues here, too, that's still happening, since we still do have people who are unvaccinated working in senior living and care communities. Can you shed the ethical principles onto that question?
Well, I think that, and Jeff, feel free. I think, Penny, that autonomy is one of them, the autonomy, again, of the elder and the staff. I have heard stories like you've suggested, and I've heard stories where the elder said, I don't want someone unvaccinated taking care of me. But I think beneficence, about doing the right thing, weighs in here, that non-malfeasance, which is do no harm. So the do no harm piece kind of really hits hard in my mind, in this scenario. And again, that also relates back to the physician's Hippocratic oath about doing no harm that they take. And I've heard many physicians very concerned about this. So the risk to the staff compared to the risk to the elder, you have to start thinking about those in relationship to doing no harm and doing good. The elder, we know today, is far more at risk probably than most staff. Any elder living in long-term care is probably way more at risk than staff. And so what do you do about that? I mean, some days I see an elder who I know is at risk who hasn't been vaccinated at all, and staff members who are unvaccinated taking care of the elder. So there we have people who could be bringing the virus into the community, unvaccinated, caring for someone unvaccinated. So all of those tools that we have in preventing infection become really paramount. And could we think, as a nursing home, if I'm going to let the elder be the guidance star and some are not vaccinated, staff and elder, then how do I maybe think about switching this up? What do I do to protect that elder so they don't have coronavirus? What do you think, Jeff?
Well, I agree. You can look at every nursing home's mission statement, by and large, is always not just quality of care, but quality of life. And because there's a percentage of unvaccinated people, residents are forced to not have the opportunity for quality of life, even if they are safe in their room or isolation has such a toll. And if it's unsafe to be part of a group or to be part of a group event, for example, I know a couple of people that got, not in nursing homes, but that got the virus because they had a bus ride. They were vaccinated, so it was one of those breakthroughs. It was not a bad case. I know two people that took bus rides, and even though they were vaccinated, they got COVID, mild case. But in a situation where, we had a lot of wheelchair-equipped vans, and we would take residents to different things, and part of, whether it's museums, shows, concerts, whatever. As part of a life experience, which is now taken away until we get to a safe situation in this society. So even though I'm a vaccine I hesitate sometimes. In this situation, you have a worldwide pandemic where 750,000 people have died, and disproportionate percentage of it being elders, and even more disproportionate percentage being elders in nursing homes, where there's now a different obligation here, other than your own personal hesitancy. That's the conclusion that I came to.
And you could, Penny, based on your question, it's taken us, 40 years or more to get staff and elders to take the influenza vaccine and develop it so that we know it's working, but every year we wonder how much antibody will be developed towards the right influenza. So it's a complicated, but I think many nursing homes that I'm familiar with are having weekly calls with families. So they send out a Zoom notification. I don't know if you've heard this. And they are talking about what's going on in the vaccine, in the nursing home and relative to vaccination. I do know of a story where an elder the family changed their mind about getting the elder vaccinated. And she did not have capacity to understand all of that and only wanted to do what her family chose for her. And although she'd had many vaccinations, she told me this story herself. But eventually she got vaccinated. Her power of attorney, durable power, changed their mind as they got more and more information. So I think making sure that communication is flowing, that family members like a daughter or durable power are really informed about what the community is doing to talk about vaccination and why it's important, and be sure that families have access so they can ask questions. Talk to the medical director if they need to. And our medical director, and I think most in Colorado, or ours, one that I know, said that I don't want to bully staff into taking vaccination when I'm talking to them. Again, that compassion piece comes up.
I hope that the nursing home profession, I think they're on their way to doing this, but we develop a positive message about, we get to the point where you have whatever the percentage is, 90%, 95%, or 100%, but we are, and your protocols for allowing visitors and guests and vendors, which also needs to be addressed, that we are a safe community. Come work for us. We are a safe community, and we are, dedicated to the safety of the people we serve, and we're dedicated to the workers and their families of the workers. And try to get a positive designation going. I almost think sometimes like a certificate of whatever, but some designation that this nursing home follows very safe practices, and that because we have a workforce problem, and we know we lost people who would not take the vaccine, so they just resigned. But we got to replace those people, and we had a shortage even before this. But we got to not only replace those people, but attract new people into long-term care. We got to present a positive message. To have a career besides serving others, which could be very positive for some people, and the fact that safety is safety, and making meaningful life are our priorities in this nursing home.
Yeah, I wanted to just jump in for a minute. Thank you so much for this discussion. And again, if anybody has any thoughts, comments, drop them in that comment section. But, a couple of things that I've heard, and I would be curious to hear your take on this too. I think every one of us on this call, especially, for us at the Eden Alternative as well, we talk about deep knowing relationships and how important they are. And so it was really interesting for me that I've seen some of my friends who work in the industry say, you know what? I don't really agree with this. I don't want to get this, but because of my relationships of the people I serve, that's how close they are. They're an Eden Alternative home. They've developed these deep knowing relationships with each other, and the whole care partner team. And that obviously includes the elder that they serve. And they said, I want to get the vaccine because I want to make sure that I'm not bringing anything in here. And I've also heard them talk about using safer practices when they're not at work. And it's for that same exact reason. So it just really struck me that, when you do get to know each other so deeply, when you do have relationships with people, you're going to care more. Right. So I don't know if you've heard anything. That was something that it was just great to hear in my heart as one of the reasons why people were, even though they didn't agree.
I think that's a great message, Chris. I'm not sure I've heard that message out there, that elders becoming well-known, having these deep, meaningful relationships with them. I think there's many places where that is the case, but then what do we tell staff to do? Should they go to that bar on Saturday night? And maybe in the summer it was okay, but excuse me, right now we've closed things up and people are inside. And how safe is that? Is that bar still requiring masks? Probably not. And what do you do instead? Can you stay in and do something fun with your family, play a board game, or, just hang out with people that, are going to be safe? So I think that's a really good message about what do you do when you're not at work, because I know that still, even though I might find pandemic fatigue a problem for myself, and I know many people have, that we're all sick and tired of this. We want it to just go away. But we do have to practice safely if then we're going to walk into a nursing home, and know that we're faced with a large number of elders that we may interface with if they're not in some kind of they have isolation going on because of quarantine and those things. So you do have to be safe. You have to remember that 20-second hand wash. You have to remember to have your mask with you. You have to make safe choices about what you're going to do. And most of our staff is very young, and they live in different arrangements than the four of us might live in. I live with my husband. I'm kind of retired, and so they have different things to think about, but keeping themselves safe is really important. Thank you for bringing that up, Chris. I think that's a message that we could get out there. What do I do when I'm not here? And Jeff, how is the message positive so that we can retain staff? Because in all of this, we don't want to lose this great staff that we already have. And when we wrote this white paper, we didn't have any staffing issues going on, or not the ones that we have right now. Maybe we should talk for a minute about indoor visitation, which may not be a problem that we see right now in Colorado, but still a problem in other places or in nursing homes and assisted living that may have quarantine requirements because their health departments have required that of them. So early in the pandemic, I remember Penny and I having a conversation about indoor visitation and what was going on here in Colorado, because we were hearing all about the essential care partner. So I'll define that for you because it gets confusing to hear that message. And that care partner is an Eden term, but I love it. And the essential word was about we really need them. They're essential to the well-being of the elder. So that was bringing a family member, a very close friend in, that would learn infection prevention techniques, the use of protective equipment, the mask, the maybe the shield or the goggles, how to gown, how to glove. If you needed more than that, what would that look like? And how they could provide um, prevention of loneliness, helplessness, and boredom. How they could improve that quality of life of the elder. But we didn't see too much of that happening. And so that was a solution that we talked about in developing our paper. But I don't know, Jeff, what are your thoughts about indoor visitation?
Well, I think there should be protocol. I think that we should have indoor visitations with proper protocol, like you're suggesting. I think if you're unvaccinated, I think then you try to have it outdoors. I think it's more, if you're vaccinated, even though there's still a risk, but I think it's maybe a more acceptable risk if for some reason outdoors is not possible. But we're still learning, this is the whole thing about a novel virus. Which is 18 months or 20 months in our consciousness, even scientists. We're learning new stuff every day about things, and we're learning a lot of lessons in long-term care. And one of the things we hope is to take away is that we have a lot of issues in long-term care. We always have, but ethics committee can provide a great way to get a North Star and to develop a way to conscientiously talk about critical issues. I will say we also learned that private rooms and private bathrooms really mean a lot more than just having to live with a roommate that are strangers to us, which was always an issue. If you ask people, why are you afraid of going into nursing homes? One of the top issues is I don't want to live with somebody I don't know in a small room. And that was an issue that's been ignored. Not ignored by everybody, but in terms of public policy, it was ignored by Oprah, nursing home reform in 1987. They didn't even address that issue in any satisfactory way. And so now we learned there was a price that we're paying for that. It could have started in 1987. We could have had public policy that would have encouraged more private rooms and private bathrooms, et cetera, better ventilation with and that still is, something that has to be done in the future, because this is not the last pandemic, and we're not even finished with this one, but there will be others.
So in relationship to that, maybe we're talking about futility of treatment, that it would be futile because people are living in such close quarters with each other in long-term care, where they're, like Jeff suggested, they're sharing a room. Maybe they're sharing a bathroom for people in some older communities. So thinking differently about what that environment looks like and how to create a place where people can be in their own room with their own bathroom would certainly prevent the spread of virus. And we've seen that happen over and over in the pandemic based on small house models like the greenhouse. Where there has been less virus present. There could also be limited resources could come into this. Early in the pandemic, I think the stories that are in our paper talk about nursing home administrators and directors of nursing being in fear of people coming in. And some of it was because their resources were so limited. We were talking about masks a while ago, and they would take their N95 and hang it up and have to use it for a week. Do you remember those stories early on in the pandemic? Well, that was because we had a shortage of supply. All of a sudden, we were using so much more, many gowns and gloves and masks than we'd used before. And all of those things are considered one-time use, disposable, and staff was hanging them up in the room and using them over and over. So I do think that we still, we could avoid futility of treatment. We could do the right thing with beneficence by getting our nursing homes into a place where there's just one person in a room. That does financially affect an ownership group. But again, if the elder is the North Star, then that is the right thing to do. And these were the things that I would say in an ethics committee.
So I have a question to go back to visitation a little bit, because I think that, you know, Beth and Jeff, you're based in Colorado. You definitely see what's going on here, but we also know that there are other states that have been more conservative in their visitation policies. New York is one of those states. Delaware is one of those states. And again, personal experience here, both of those states still have communities where the policy is one person, 1 hour. It's not open to others. And you know, we're what, 20 something months into this, 21 months into the pandemic now, and we still have residents who are going through still these periods of isolation from their family and friends because of the visitation policies. Can you give us any guidance on how we weigh the ethical principles in light of that, in light of the fact that, you know, we have all this information now? We also have CMS that has been pushing visitation. How do communities who are struggling to adhere to the guidelines in front of them, but also care for the residents who are there and support the residents there, how do they deal with this? Any words, any pearls of wisdom?
I understand the fear that's present, and the fear that might be coming from a state health department trying to control the virus and the numbers. I do know from looking nationally that we're all doing it the same way now. We have maps with percentages in certain communities and counties, and that might drive decision making about how how they visit. I do think, though, on the other hand, that the elder is dying of failure to thrive and isolation and loneliness and boredom. And these are things that we've worked on for so many decades now to eliminate. And you know, these are the dragons that we want to slay in long-term care. And so I think we have enough understanding and resources about how the virus acts and spreads that we should be able to open up the nursing home for visitation. You know, maybe there's days there's too many visitors there, and we should ask people who've been there a long time, maybe it's time to go home if we're really worried. I mean, I had trouble even convincing a community about holding a birthday party in private space just recently. No one had COVID. Everyone who was going to attend was vaccinated. And I do think a nursing home could make that requirement if you're coming in, because I have nursing home administrator friends who say, I just look at that front door all day long, worried about who's entering. So I do think there's ways through this, Penny. I no longer think that we have to stay closed. We have got to give the elder an opportunity to touch and to be loved and hugged, and the things that are really important to sustaining human life.
Yeah, I agree with Beth. But there's so many countervailing things. What Beth said is right on, but then, you know, people are also living in fear. Administrators, and Beth, you've told me a lot of stories about that over the last number of months. Administrators that are just in fear that somebody is going to bring in the virus, and boom, you know, they're facing a complete disaster. And not only from what can happen in the facility, but the health department reaction, possible litigation reaction, all sorts of things. And, you know, fear is something that needs to be overcome, but not easily overcome in this situation when the virus is really almost a death sentence if an elder catches it. I mean, well, it's much more severe if an elder catches it than if a young, healthy individual gets COVID. They have a very good chance of being fine, but an elder in a nursing home is close to a death sentence. So that's sobering in how we approach things. Yes, and isolation and loneliness and all that is also a death sentence. So there's not an easy way. This is a perfect thing. Why it's perfect for an ethics committee, because there are no right answers.
I also imagine an ethics committee, Jeff might talk about staffing and consistent assignments, really permanent assignments. So hard to accomplish right now, but early on in the pandemic might not be so difficult. But get the same people taking care of the same elders as much as you can every single day, to avoid any more virus being exposed to that elder. As we talked about earlier, with staff coming back into the community, being places and not being vaccinated. But for those listening, and you do still have a architecture that's floors and units, and but try to divide that up and find ways to keep staff in the same place. Make sure your practices are consistent, and then ask families if someone on that what we would call a neighborhood has the virus. Then ask families to be sure that they're washing their hands and wearing their masks and doing the things that they need to do.
Yes, and I would advocate for a long-term strategy, because these are in that this is going to happen again if we don't learn our lessons. The same tragedy will happen again. Maybe in 5 years, 10 years, 15 years, I don't know, but it'll happen again, because we're going to be getting more pandemics, in my opinion, unless we get the climate under control. But I would say that, so we have learned lessons, and I think that providers, advocates, etc., anyone caring about elder care, we need to have policy that will make this affordable and make this and incentivize providers to invest in the future of long-term care, which is private rooms. And this should have been done a long time ago. And we want, what's the number one fear of anybody going into a nursing home? It's generally going into a room with somebody they don't know and having to share a room. That's usually the top 2 or 3 fears of why people don't want to go into a nursing home. We ignored it. And now we have the perfect storm. We have a pandemic that showed that there's a medical necessity for this, not just the right of privacy and socialization and having your own space, but there's now a medical need for this. So that should change the politics of this if we could get unified.
And the ethical principles can give you guidance, even about things like architecture.
Yeah.
Give us guidance about care and decision making around other things in the pandemic, but they can give us guidance about any decisions that we need to make around the life of the elder. And if the elder looked at these principles in a learning circle, they would be able to discuss these and understand them. The terms may be new to them, but the concepts aren't. So we still have some work to do. We've done a great job across the country. We have a lot of elders vaccinated and a lot of staff. So I think that we can continue to do more. And like Jeff said, we can be ready for what's coming, whatever might come next. But change is needed.
Yes, change is needed. And Jeff, as you said, it was needed a long time ago, right? We all know that. So once again, now is the time. So really thank everybody for being here. We're almost at the top of the hour. I'm sharing a link because guess what? We're going to continue on this discussion. So we have a Zoom, it's not a show, it's a gathering, a chat where we can all discuss and anything you heard today. So please join us. It's actually this Friday that we're having it, and at 3 p.m. again, same time. Eastern time. So the link is right in there for you, and it'll live in the comment box. So feel free to check that out. Beth, Jeff, Penny, I thank everybody for being here today. Any last words? What do you think?
The wisdom of elders.
Yeah, listen, this is old expression, listen to your elders. See, none of the elders are vaccinated. So all you got to do is listen to your elders.
There you go. There
All
you
right.
go. All right. Well, thank you very much. And I hope everybody joins us this Friday. And again, you can register right there for the Zoom to continue talking about this. It really is interesting, so many different sides to it. So thank you, everybody who joined in and who's watching on the replay. And we'll see you next time.
Thank you.
you. Bye-bye.
Bye.